These are the learning objectives that you should be able to enumerate the compartment of the forearm and how the compartment are formed in the forearm. Discuss the muscles present in the anterior compartment. Explain the division of the muscle layer in the anterior compartment. Discuss the action performed by these muscles. Explain their nerve supply. Discuss the course of the vessels present in the muscular compartment, and describe the attachment of the flexor retinaculum along with the clinical correlation. The forearm is divided into anterior and posterior compartment by the presence of the thickening of the deep fascia and the interosseous membrane. If we remove the skin and the superficial fascia, we identify a tight covering around the forearm, and that tight covering is called as a thickening of this tight fibrous covering is the deep fascia. That deep fascia provide attachment on the certain places and divide the compartment of the forearm into anterior and posterior. The thickening is in the form of an intermuscular septum, that is the lateral intermuscular septum attached on the anterior border of the radius, and posterior part or the posterior border of the ulna provide the attachment of the thickening of the deep fascia, as well as a membrane present in between attached on the interosseous borders of the radius and the ulna, that is called the interosseous membrane, collectively divide the compartment into anterior and the posterior one. So anterior compartment bounded laterally by the lateral intermuscular septum, medially by the thickening of the deep fascia at the posterior border of the ulna, and posteriorly separate from the posterior compartment by the interosseous membrane. So the deep fascia of the forearm is enclosed in a sheet of a deep fascia which is attached to the posterior border of the ulna. It forms a sheet for which each muscles and the group are separated. This fascial sheet, together with the interosseous membrane and the fibrous lateral intermuscular septum, divides the forearm into several subcompartments of anterior as well as the posterior compartment, and they allow the passage of the blood vessels and the nerves into these compartments. So anterior compartment could easily be visualized in this picture, in which the muscles are stepped out, the nerves and the vessels can easily be visualized. In the upper part, the bulkiest part of the muscles are present, while in the lower region, the muscles tendons are visualized in this picture. So anterior compartment comprises of 8 muscles arranged in 3 different layers, 2 arteries and the 3 nerves. The 8 muscles arrange themselves into superficial, middle and the deep layer, while the 2 arteries are the radial and the ulnar arteries are the major arteries of this region, and the nerves are the median nerves, radial nerve and the ulnar nerves are the nerves that are present in the anterior compartment or the flexor compartment of the forearm. So these 3 group of muscles are the superficial layer, the flexor carpi ulnaris, palmaris longus, flexor carpi radialis and pronator teres could easily be visualized if we remove the deep fascia. So these are the arrangement, that is the lateral to medial is pronator teres, flexor carpi radialis, palmaris longus and the flexor carpi ulnaris muscle. These are the muscles present in the superficial layer. Okay, again they can easily be visualized from lateral to medial: pronator teres, flexor carpi radialis, palmaris longus and flexor carpi ulnaris muscle. Okay, pronator teres forming the medial boundary of the cubital fossa, then flexor carpi radialis, then palmaris longus between the flexor carpi radialis and the ulnaris. The intermediate group contain only a muscle that is called as a flexor digitorum superficialis. This is a thick muscle and it arises from the different sources a bulkous form in the middle of the forearm, while they reaches to the proximal distal part of the forearm, divided into 4 tendons. And the importance of this muscle is that it is an important anatomical landmark regarding the median nerve and the ulnar artery that passes between its two heads, and then it travels posteriorly. Then the muscles present in the deep group are 3 in number. These are the flexor digitorum profundus, pronator quadratus, and flexor pollicis longus. These are the, if we remove the flexor digitorum superficialis, we could easily visualize these 3 muscles, that is the flexor digitorum profundus, flexor pollicis longus, and in the lower end the pronator quadratus. Now the description about the superficial muscles. All the superficial group of superficial muscles arises from a common region that is called as a common flexor origin, and that region is the anterior surface of the medial epicondyle of humerus. So the humerus medial epicondyle act as a common site of the common flexor origin. Beside the origin of the common flexor, the additional origin of pronator teres and flexor carpi radialis is also present, but mainly the flexors of superficial arises from the medial epicondyle, that is termed to be as a common flexor origin. Now the most lateral muscle of the anterior compartment in the superficial group, that is the pronator teres. It arises again from the common flexor origin and the supracondylar ridge. Its small deep head arises from the coronoid process of the ulna. Okay, so it has 2 heads, superficial larger head and a deep smaller head. Superficial head arises from the common flexor origin from the medial epicondyle and the supracondylar ridge, while the deep arises from the coronoid process of ulna. They insert it into the middle of the lateral surface of the shaft of the radius, and it is prominently visualized because it attached on the outward convexity of the radius. It is supplied by the muscular branch of the median nerve, and its action is pronation, and while pronation it rotates the radius over the ulna. So it is the pronator. As the name suggests, it is the pronator, and it rotates the radius over the ulna, and it also behaves like a weak flexor of the elbow joint. Next muscle that is lateral medial to the pronator teres is the flexor carpi radialis. Flexor carpi radialis, again it has a common flexor origin from this medial epicondyle. Is a fleshy tendon, a fleshy mass in the middle of the forearm. While it reaches to the distal half or distal part of the forearm, it becomes into a tendon, and it grooves on the trapezium, while it inserted into the second and the third metacarpals on the palmar surface of the hand. Radial artery lies lateral to the tendon, and median nerve lies medial to the tendon. So the tendon is a landmark demarcation between the radial artery that lies on the lateral side and the median nerve that lies on the medial aspect of the tendon. It is supplied again by the median nerve. All the muscles of the anterior compartment of the forearm are supplied by the median nerve except the part of the flexor digitorum profundus and the flexor carpi ulnaris. So this again it is supplied by the median nerve. Its action is act as a flexor and the radial abductor of the wrist, and also stabilizes the wrist joint. Then the superficial tendon visualized is the palmaris longus. It it is absent in 15% of the total population. It arises again from the common flexor origin from the medial epicondyle of the humerus, broaden down when it passes from the upper part, and then it taper down into a tendon, and again it attached into a triangular type of structure to split into small extension to attach on the skin. So they split longitudinally directed fibers and they get attached to the flexor retinaculum and the skin of the hand. So it acts as a deep flexors and it anchors the skin and the fascia of the hand supplied by the median nerve. Then the last muscle in the superficial group is flexor carpi ulnaris. This is an important muscle because the nerve, ulnar nerve passes in between the two head of the ulna. This flexor carpi ulnaris behind the medial epicondyle of the humerus, and it get interrupted during these two head and causes the numbness of the distribution of the ulnar nerve or causes the entrapment of the ulnar entrapment syndrome. It arises again from the common flexor origin, and it also originates from the origin is from the medial border of the olecranon process or the subcutaneous border of the ulna. The two heads provide the passageway of the ulnar nerve in between them. They become a tendon part into the lower part of the forearm, and then they attached on the pisiform bone by ended up into a piezohemate and the piezometacarpal ligament at the hamate and the fifth metacarpal. Again, these are the muscle as its name suggests on the ulnar side, and it receives the nerve supply from the ulnar nerve. It is a flexor and the adductor of the wrist joint. Now the muscles in the intermediate group of compartment, that is the flexor digitorum superficialis. So it is a muscle that form a thick muscular belly in between the superficial and the deep group, and it has a common flexor origin from the medial epicondyle. It also arises from the tubercle of the coronoid process of the ulna, and it also originates from the whole length of the anterior oblique line of the radius. So they arises from three different sources. Then they combine together to form a bulkiest part of the muscle bulk, and then in the lower part of the wrist of the forearm near the wrist, it is split up into four tendons to attached on the medial four fingers. So the tendon passes beneath the fibrous arch present at the wrist, that is called the flexor retinaculum. So the tendon passes through the arch, and they arrange themselves into two groups, superficial and the deep group. In the superficial group, the middle and the ring fingers tendon are present, and in the deep group, the tendon of the index and the little finger are present. So when they reaches to the the proximal phalanx, they split up into two, and then they attached on the middle phalanx. Okay, and they allow the passage of the, when they split out, they allow the passage of the tendon of the flexor digitorum profundus. They enters the flexor fibrous sheet and divide into two halves and attached on the margins of the front of the middle phalanx, lateral side of the middle phalanx. They are supplied by the median nerve, and their action is they are the flexors of the proximal interphalangeal joint, metacarpophalangeal joint, and the wrist joint. Okay, so they are the flexor of the proximal interphalangeal joint, metacarpophalangeal joint and the wrist joint. So they are helpful in the skilled movement of the fingers. This is again a picture that shows the division of the flexor digitorum, tendon of the flexor digitorum superficialis into two at the base of the at the proximal phalanx, and then they attached on the middle of the shaft of the lateral side of the middle phalanx, and they allow the passage of the tendon of the flexor digitorum profundus. They attached with the bone by the small ligamentous cord that is called the vallicula longa and the vallicula breva. Now the deep muscles of anterior compartment are the flexor digitorum profundus. This is the bulkiest muscles of the deep region, and it has originate from the medial surface of the olecranon process and upper 3/4 of the anterior and the medial surface of the ulna, included the interosseous border and the interosseous membrane. Then the it inserted the tendon get form at the lower part, and they split up into 4 for the medial forefinger, terminate at the terminal phalange or the distal phalange of the medial forefinger, included the little finger, index finger, ring finger and the middle finger. They are supplied by the anterior interosseous branch of the median nerve and the ulnar nerve. So the medial half, the tendon of the little and this ring finger are supplied by the anterior division, the ulnar nerve, and the index finger and the middle finger are supplied by the median nerve, the anterior interosseous branch of the median nerve. The action of these muscles, because they attached at the terminal phalanges or the most distal phalanges, so they flexes the terminal interphalangeal joint. They passes in between the gap of the two division of the flexor digitorum flexor digitorum superficialis muscle. So they provide the gripping during the flexion. Okay, again a picture shows the passageway of the flexor digitorum between the splitted tendon of the flexor digitorum superficialis. Then the muscle that is present in the deep layer is the flexor pollicis longus. They originate from the anterior surface of the radius just below the oblique line and above the insertion of the pronator quadratus. So in the whole anterior surface give the origin of this flexor pollicis longus. They passes underneath the flexor retinaculum because they are the longest tendon, so they attached to the base of the distal phalanx of the first finger or the thumb region. They are supplied by the median nerve, so the anterior interosseous branch of the median nerve is the nerve supply of the flexor pollicis longus. Their function is they are the flexors of interphalangeal joint of the thumb, also flexes the metacarpophalangeal joint of the thumb and carpometacarpal joint of the thumb and the wrist joint. The small flattened muscles present in the deepest part of the anterior compartment is the pronator quadratus, and it is small flat quadrangular type of muscle present in the lower part of the anterior aspect of the forearm. They originate from on the anterior aspect of the ulna and inserted into the anterior surface of the lower fourth of the radius in a triangular area above the ulnar notch. It is supplied by the interosseous branch of the median nerve, and their action is the pronation and help to hold the lower end of the radius and the ulna during the pronation. Okay, so we can identify the pronator teres, then the flexor carpi radialis, then the palmaris longus tendon, and then the flexor carpi ulnaris tendon. Now the artery that is found in the anterior compartment is radial artery, and the radial artery is the most superficial artery in the anterior compartment. It is the small terminal branch of the brachial artery and arises in the cubital fossa and enter into the forearm at the neck, approximately at the neck of the radius. It runs downwards in the convexity and leave the forearm by turning around posteriorly into the anatomical snuff box, where while in its whole course it is most superficial structure and related with the superficial branch of the radial nerve, and it lies only deep to the brachioradialis muscle in its middle part. The branches that arises in the anterior compartment of the forearm are the radial recurrent branch, and that radial recurrent branch take a part in anastomosis around the elbow with the radial collateral branch. It also gives the muscular branches to supply the adjacent muscles. It also gives the palmar carpal branch, and it anastomoses with the palmar carpal branch of the ulnar artery. It also gives a superficial palmar branch, act as a terminal branch in the palm, and it articulate with the anastomoses with the ulnar branch to form the superficial palmar arch. Now the main arterial supply is through the ulnar artery. It is the larger terminal branch of the brachial artery, and it begins in the cubital fossa around the neck of the radius, descends anteriorly in the compartment more towards the medial side, and it's related with the ulnar nerve, and it passes enter into the forearm, bypasses superficial to the flexor retinaculum by terminate to anastomose with the superficial palmar branch of the radial artery to form the superficial palmar arch. So branches that found in the of ulnar artery in the anterior compartment are the anterior and posterior ulnar recurrent. These are the two branches in the upper part of their origin, and these two branches they take a part in the anastomosis around the elbow joint in front and behind the medial epicondyle. So anterior ulnar recurrent anastomose with the inferior collateral, while the posterior ulnar recurrent it anastomose with the superior ulnar collateral. When it reaches to the interosseous membrane, it divides into common interosseous, give the common interosseous artery, and that common interosseous artery give the anterior and the posterior interosseous artery and the interosseous recurrent artery. So posterior interosseous, it passes behind the interosseous membrane and supply the posterior compartment, while anterior interosseous it passes the gap between the flexor digitorum profundus and the flexor pollicis longus, and it runs on the deeper muscles and runs on the interosseous membrane, and it gives the branches and take a part in anastomosis around the wrist joint, that is called the palmar carpal anastomosis. It gives the muscular branches, it gives palmar and dorsal carpal branches, and terminate as a superficial palmar arch. Now the nerve that found in the anterior compartment is the major nerve, is the median nerve, that is the main supply of the anterior compartment. All the muscles are supplied by the median nerve except the medial part of the flexor digitorum profundus and the flexor carpi ulnaris. So in the cubital fossa, it passes deep to the bicipital epineurosis, and it leaves the fossa but passes between the two head of the pronator teres. It enters into the forearm by passing between the two head of the pronator teres. Then it descends down between the flexor digitorum superficialis and flexor digitorum profundus. So it lies between the superficial intermediate layer and the muscles of the deep layer. Then it passes, reaches to the from the cubital fossa to the wrist joint. It is almost in a straight line, and it reaches to the flexor retinaculum, passes deep to the flexor retinaculum, and before entering into the flexor tunnel, it gives a superficial branch. So it passes deep through the carpal tunnel, lateral to the tendon of the flexor digitorum superficialis, and deep to the palmaris longus tendon. The branches that arises from the median nerve is muscular branches that supply the muscles of the anterior compartment to the pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and the articular branches to the elbow joint, anterior interosseous nerve that supply the deep muscle included the flexor pollicis, the flexor digitorum, and the flexor pollicis longus. It gives the palmar cutaneous branch that passes superficial to the flexor retinaculum and supply the skin lateral 2/3 of the palm and enter the palm through the nerve itself enter the palm through the carpal tunnel and gives off the muscular branches or recurrent to the thenar muscles. So they terminate by dividing into 3 common palmar digital nerves, as it is visualized in this picture. Then the ulnar nerve only supplied the 2 muscles in the anterior compartment, that is the medial part of the flexor digitorum profundus and the flexor carpi ulnaris. It is deeper in its whole course. It passes between the 2 head of the flexor carpi ulnaris to enter into the forearm by passing behind the medial epicondyle of the humerus and enter into the forearm between the 2 head of the flexor carpi ulnaris. It in its whole extent it lies on the medial aspect and it runs in between the flexor carpi ulnaris and the flexor digitorum superficialis in the middle and the lower part of the forearm. Enter the hand superficial to the flexor retinaculum along with the ulnar artery. Its branches included the muscular branches in the forearm only supply the medial half of the flexor digitorum profundus and the flexor carpi ulnaris. Articular branch to the elbow. Palmar cutaneous branch that passes superficial to the flexor retinaculum and supply the medial 1.5 of the palm. And it gives the dorsal cutaneous branch that supply the 1/3 of the dorsal surface of the hand and the dorsal surface of the medial 1.5 finger except the nail bed. Radial nerve is a superficial nerve, and it does not give any nerve the muscular supply or motor supply in the anterior compartment of the forearm. It has only a superficial branch, and that superficial branch runs along with the radial artery in the under the surface of the brachioradialis, and then it little curve down to supply the lateral cutaneous nerve of the forearm. Now the flexor retinaculum, it is a strong fibrous band. It lies across the carpus bone and cover the concavity of the carpal bone to form a tunnel, and the attachment of the flexor retinaculum is on the medial side. It is on the hook of hamate and the pisiform, and on the lateral side it attached on the tubercle of the scaphoid and the ridge of the trapezoid. When they attach to the trapezoid, it form a tunnel, a small tunnel within that flexor retinaculum, As the carpal bones has a concave arrangement, so the flexor retinaculum attachment provide a tunnel to allow the passage of the flexor tendon in front of the forearm. So it acts as a handcuff, or it acts as a wristband around the anterior aspect of the forearm, provide the positioning of the tendon within their place and the mobility within the anterior compartment of that arm. Median nerve and the long flexor tendon passes through the tunnel formed by the flexor retinaculum, and the superficial tendon passes through into two separate rows, and that is the tendon of the flexor digitorum superficialis arrange themselves into two separate rows, that is superficial and the deep. Superficial contain the middle and the ring finger, while the deep contain the tendon of the index and the little finger. So this is the attachment of flexor retinaculum, pisiform and the hucophameate and the scaphoid and the triquetrum in the lateral side, and allow the passage of the flexor tendon to enter into the hand. Okay, so superficially the tendon arrange themselves into two rows, the superficial for the middle and the index finger, the ring finger, and the deep one for the lateral, the little finger, and the for the index finger. Again the picture shows the arrangement of the superficial arrangement of the flexor digitorum superficialis muscle. They arrange themselves into two groups, and the tunnel septa divide this tunnel into superficial part and the deep part, and the deeper part contain the tendon of the flexor digitorum profundus. The median nerve lies between the flexor digitorum superficialis and the tendon of the flexor carpi radialis. Flexor pollicis passes deep in the tunnel, and the flexor pollicis, the flexor carpi radialis, by the attachment of the fibrous retinaculum on the triquetrum, crust of the triquetrum, it is form a tunnel separated for the flexor carpi radialis. Okay, another picture that shows the flexor retinaculum, passage of the superficialis muscle and the profundus, flexor carpi radialis, and the flexor pollicis longus, and the median nerve. Okay, so the median nerve motor supply of the thenar eminence is through the median nerve. So median nerve passes deep to the flexor retinaculum, and if the nerve get interrupt in the flexor retinaculum, it causes the thenar hypertrophy and the paralysis of the muscles, or the sensory or the motor supply entrapment into the distribution of the median nerve. So condition that is called the carpal tunnel syndrome, a common clinical condition associated with the female, diabetic female, and that is the either the thickening of the synovial sheet, or the swelling in the synovial membrane, resulting into the entrapment of that nerve within the tunnel. So the compression of the median nerve within the carpal tunnel is called as a carpal tunnel syndrome, occur usually in the female after menopause, or the having a history of diabetes, rheumatoid arthritis, pregnancy, or the myxedema. The symptoms included the pain and the paresthesia occurring along the distribution of the median nerve, that is lateral 3.5 finger, and it resulting into the motor supply, resulting in the wasting the muscle, that is the motor supply of the thenar eminence. Treatment included the splint may be and the steroid therapy could be given. If the condition is severe, the surgical release of that nerve could be done.